So here, you have depression of the humeral head too, but it is for posterior head activation at the same time. Yeah. From then, we go to the supported 3-month vertical, if you want to call it that, hand on head vertical. So I can have hand on hip, or I can have hand on head. It will really depend on how loose the joint, lateral humeral joint is. So if I have this, not going to work very well. I slowly need to get into this position. Yes. So the person can start with the hand on the thigh, and they must try to bring the shoulder back without taking the elbow back. So here I take the shoulder back without taking the elbow back. Yes. And then I slowly, if I cannot do it here, I start somewhere where I can do it. And slowly, as I'm doing my stretches, I train to bring this until I can do it in my side.
Wait.
There she goes. Mm-hmm. What?
What are you bringing back? I feel like that's
I'm trying to bring the humeral head back.
So not scap retraction.
No, not scap retraction. That stays. That's why this reaches out whilst this goes back.
So is that like asking subscap, or we're not?
It is asking subscap to do it. It is asking the teres major to work, and the protraction stays. Remember, we've talked about the ability to bring this without this going back. That the humerus doesn't, or the elbow doesn't chase the scapula backwards. The scapula owns the position, and the arm can move with the elbow not going to this position.
So you have to make sure that the lat doesn't take over.
That's right. So yes. So that's why I showed you the dancer who has this position. But many people are so tight in the adductors that it is not possible to make that happen. So you really have to stretch all this out until it's possible to do this. So eccentric activity of the posterior muscles is necessary. That's why you must train rolling. You must train, we can do things like this. If you come here and lie on your back, you can inhibit after you've done everything, because now I'm sure that the thorax is in neutral. So I go here and I go, okay, this is how much I have. I need to inhibit the external rotators. So what I can do is I ask her to stay here, and I go, when I do this, you stop me. Good, good, good. I press this down, I centrate it, don't let me push it back. Good, good. And then you can see that it will start to allow more and more internal rotation. So once you've treated everything, and you know now this is local contracture, you can use local focused treatments. Now you can grasp in the back. Now you can go, sorry ma'am, you can go in and get that tight dry needle, that tight infraspinatus, which will not allow the fibers to come all the way around. Yes. So this is what you are going to do. And then she is going to learn to put her hand in the side and take that back. Yes. So I can put a little cushion and I go, pull this down towards me. Yes, pull this down. But it's painful. So she'll just start, relax, let me push it up, pull it back and down. Yes. Go back up, pull it back and down. Yeah, it starts to come. So the brain at first goes like, We can't do that. It's stupid. But then it starts to go, oh, is this what you want? Yes, I can feel this, and it will let you go. So, because I remember a couple of years ago, I go, what the hell is wrong with my shoulder? I can't put it in. And it was painful. So every day in the shower, I would lean against the wall with my elbow and try to move the shoulder back. And after a while, it started occurring, and then I go, oh, this is better than this. Yeah. So again, home exercise, you stand with your hand like this. You stand against the shower wall, you turn as much as you can towards it, and now you try to put your shoulder against the wall. Wall. Do it 3-4 times, you go about your business. You do the other side, you're done for the day. Next time you shower, you do the same thing. After 2 or 3 weeks, you'll have your motion back. But repetition is how we got here. So repetition can take you back there. You just have to do it enough times without stress for the brain to go, well, I do remember this position. I used to own this, and I can own it again. But you have to be consistent for a few weeks to make it work.
It's like a reverse sleeper stretch.
That's right.
Right, because like you're not taking the distal segment.
Yeah, you're not doing
right?
this.
You're holding
Yeah,
the distal segment.
That's right.
And
making that happen.
Yeah.
And it is better, I think, because it rarely does open the shoulder. And you will only do this when you know you have a local contraction. That's the problem with the sleeper stretch. You cannot just give it because it improves internal rotation. You must give it because you know that you have cleared everything else except the contracture of the posterior tissue. Yeah. Okay, so that's what we do.